Hi, I'm Dr. Meyer, and I'm a reproductive endocrinologist at RMA of Connecticut. And today I'm going to be talking a little bit about options for fertility preservation for women of reproductive age who have cancer. With a new diagnosis, it's typically a very intense time as patients are navigating completing their workup and their planning for their treatment as it pertains to their cancer, but it is also an important time to think about future fertility. Many of the treatments that people may take to treat their cancers can have an effect on future fertility, and some of them can deplete the eggs in a woman's ovaries or make it more difficult for her to conceive later on. In addition, there's always a time delay, obviously, associated with cancer treatment. So if a woman is at a point in her reproductive years where she was getting ready to start thinking about building her family, that oftentimes will have to be postponed for at least a few years while she completes her treatment and spend some time taking care of the cancer and making sure she's healthy before she proceeds with pregnancy. So for these reasons, we oftentimes think about options for fertility preservation in this time period before cancer treatment is started. The most common fertility preservation method that we use for women who are going to be starting cancer treatment is egg freezing. And this is going through a process of ovarian stimulation where a woman will take some injectable medications to mature multiple eggs in her ovaries at the same time, and then she'll undergo a procedure to take those eggs out of the ovaries and to freeze them for future use. This entire process takes about 2 weeks or so and can be started very quickly, oftentimes in the period of time either maybe between a cancer surgery and when she might start chemotherapy, or before she starts any sort of chemo or medical treatment for her condition. So once eggs are frozen, they can be stored indefinitely for future use. And then in the future, when she's ready to get pregnant and is cleared for pregnancy by her oncologist, she's able to thaw those eggs and fertilize them with sperm to create embryos, and then transfer an embryo into her uterus to have a pregnancy. Another option for some women is to create embryos at the time that they undergo ovarian stimulation, which could be used in the future to create a pregnancy. So if a woman has a partner, that's something that she might consider. And embryos also can be genetically tested to make sure that they're chromosomally normal, or also could be tested for specific genetic abnormalities. So for example, in a woman with breast cancer, if she knows she carries the BRCA gene, an embryo could be tested to select an embryo that's free of the disease. And that could either be done if embryos are created up front at the time of ovarian stimulation, or if eggs are frozen and then later on down the road are thawed and turned into embryos. For women who do not have time to do an egg or embryo freezing cycle, there are also options for ovarian tissue freezing, or for taking a medication during chemotherapy that can lower the risk of egg loss and going into menopause during treatment. So we have many different kinds of options that we can offer to women who are going through cancer treatment to help them achieve their dreams of having a family in the future. After cancer treatment, when a woman decides that she is ready to expand her family, she could either use frozen eggs or embryos to create a pregnancy later on in herself, or if she has an estrogen-sensitive cancer or there's a concern for a risk of recurrence during pregnancy, there's also always the option of having a pregnancy with a gestational carrier. Furthermore, if a woman goes through cancer treatment and ultimately is not able to conceive with her own eggs, or maybe didn't previously do any fertility preservation therapy before her treatment, there are also other options for conception with donor eggs or embryos. So in summary, we have many available options to help women who are going through difficult decisions at the time that they face a new cancer diagnosis. And one of the things that I love most about doing this work is being able to offer women hope for the future in the midst of an otherwise challenging time. For more information about this topic, please check out my blog in our Learning Center. Thanks so much.